Good afternoon.
Good afternoon.
So this is your speaking subtest and which is just to assess your speaking proficiency. So we'll be providing role play cards and it will be recorded. So don't get tensed, just speak naturally. So are you comfortable?
Yes.
Okay, so I will put on the recorder. So good afternoon.
Good afternoon.
This is Reshma Kartika and I am the interlocutor for your OET speaking subtest held at Tejas Academy on 2nd November. So the candidate's name is Varsha Mohan and the candidate number 10125. Can I have your ID please?
Sure.
Okay, thank you. So, Varsha, we will be beginning with a warm up session. This is just to familiarize with each other's voices. Would that be fine?
Sure.
So, Varsha, tell me how long have you been working as a nurse?
Well, I have an experience of 2 years working in the emergency department, and right now I'm looking for an opportunity to work abroad.
Okay, thank you. So, what is your piece of advice for the future nurses?
So, I have a bunch of advice for the future nurses. The first one would be to choose this profession out of their own compassion because it is a profession with a lot of challenges. They have to go through the same. And the second would be to consider your patients as your own family members so that they can provide a quality of care to them. Other than that, I would like to say that to be updated in their profession because it is a profession which changes happening on a daily basis. So updation is really important.
Thank you for the answers. That's all about the warm up session. So, now we can proceed with the role play card. Here is your role play card.
Thank you.
You will be provided with 3 minutes of time for preparation.
Okay.
You can start preparing for your conversation now.
So how may I address the patient during the conversation?
You can call me Sarah.
Thank you.
Your time is up.
Okay.
Now we can start the conversation. You have 5 minutes to converse.
Okay.
You can start now.
Well, good afternoon.
Good afternoon.
Is this Sarah's residence?
Yes.
Am I speaking with the right person?
Yes.
Okay. Well, my name is Varsha and I'm a community health nurse. I just came here as per your GP's advice to check on your progress.
Okay.
So is this the right time to speak with you, Sarah?
Yes, please come inside.
Thank you, Sarah. At first, I just need to know how are you feeling now?
Well, nurse, my depression has improved, but I'm worried about the recent development of sleeping difficulties.
Well, I'm sorry to hear that, Sarah. You have this difficulty. I know that this might be causing anxiety for you. You don't have to worry. I'm here. I'll definitely provide solution for the same. But in order to get an understanding on your difficulty, that is your sleeping difficulty, I would like to ask some questions. Is that okay?
Yes, nurse.
Okay, Sarah. At first, I just need to know, have you noticed any triggers for this recent sleeping difficulty, which we call insomnia?
Well, nurse, I feel like my symptoms in both legs are causing my sleeping difficulty. It's like a throbbing sensation. At times, it pins and needles. Also, I have itching. And sometimes, I feel like an urge to move my legs. And I get a temporary relief from walking. All the symptoms are resulting feeling like fatigue, and also I have irritability and poor concentration.
Well, Sarah, I can understand this is causing a lot of anxiety for you and you are going through a rough phase of your life because of these difficulties, but you don't have to worry about anything. I will offer solutions for the same. I just need to know much more about the symptom that you have been experiencing on your legs. So, can I ask some questions based on that?
Yes, nurse.
Okay, first of all, can I just know the onset, like when it started actually?
It started several weeks ago.
Okay, and how about the frequency? How often do you experience this?
I've been experiencing it intermittently.
All right, and what about the duration?
It is absent in the daytime but present at night.
Well, as you mentioned that you have pain, I just need to get an understanding on the pain level. Could you please tell me, is it a mild, moderate, or a severe pain?
I'm experiencing moderate to severe pain.
Well, I'm sorry to hear that, Sarah. You don't have to be tensed about anything. I got a better understanding and I will definitely offer solutions for the management.
Okay.
Well, Sarah, based on your words, I would like to say that this is likely to be a restless leg syndrome. By hearing the term, don't be tensed because I have dealt with several patients like the same condition and I will be able to help you in this regard. At the same time, I'm really sorry to inform you that this condition cannot be cured. But you don't have to worry. To a great relief for your anxiety, I can say that this condition isn't serious and we can deal with proper measures. So right now, I would like to just advise you regarding the self-help measures which you can do initially. Can I proceed with the same?
Yes, nurse.
Okay, Sarah, at first you just need to do some leg massage, at the same time some stretching exercises, and for your understanding I'll demonstrate it after our discussion. Also I'll provide you with leaflet.
Okay.
And the second thing is, when you feel these kind of sensations, you can use a heated pad which will give relief. And finally, you need to avoid caffeine, alcohol and eating late at night if in case you are in a habit of it. So will you be able to follow these instructions that I've mentioned right now?
Yes, nurse.
Yes. Thank you for your willingness to follow the same. Would you like to ask me any questions?
Yes, nurse. Let me know if there is any medication available to treat this condition.
That's a valid concern from your side, Sarah. And as a nurse, I can give you some idea regarding the medications available which the doctor usually prescribes, which include opioids, anticonvulsants, and there are some sedatives at the same time. But Sarah, your health is my topmost priority, so I won't recommend you taking these medications because if you take these medicines, there will be some disadvantages, which include risk of opioid addiction and constipation, dizziness, and daytime drowsiness. And I don't prefer you taking these medications. At the same time, I strongly suggest the importance of self-help treatment at first before these drugs are prescribed. So if you follow my advice, I can say that you'll be getting a relief. So are you willing?
Yes, nurse.
All right, Sarah, I believe that I have addressed all your concerns regarding the sleeping difficulty, have I?
Yes, nurse, everything is clear.
So once again, I'll just brief in what we have gone through, and after that, I will demonstrate the exercises which I've mentioned.
Okay.
So based on your words, I have just made an idea that this is a restless leg syndrome, and I have told you that this is not a curable condition. At the same time, this isn't much serious. With proper management, we can.
Your time is up. Thank you, Varsha.
Thank you.